And the gentleman I'm going to introduce next, and come on up, Greg, is someone who I've been working with for a very long time, going back to pre-SOFA days. Come on up. And back when he was in the Assembly, working with the Assembly Aging Committee and Assemblyman Engelbright, and back then we had a program bill that Assemblyman Engelbright was part of and Greg was part of, called the Compact for Long-Term Care. My good friend Howard Crook's going to talk about that on one of the panels later on. But Greg is the acting director of the New York State Office for Aging. He's been acting for years, and he's doing a wonderful job. They serve 4.6 million people in New York State, and I could almost quote his average client, an 83-year-old female living alone with 6 chronic conditions, and he can tell you more about that. But that's the people they serve, and they keep them off Medicaid. These are not Medicaid-reliant people. These are people living in the community for under $10,000 a year with a network of services that Greg's going to talk about and tell you why they are currently at risk. He leads the fight against ageism. He is recognized nationally, not just for his work in aging services, but his innovation. And I love what he's done in New York State to bring innovators into New York. And he talked about it last year. He has been a leader and is on the cutting edge of what we all need to be thinking about. How do we make this better 30 years from now? Greg.
What? At work? Yeah. And what Lou won't tell you is I used to snowplow his driveway about 30 years ago. Do we have a clicker? Oh, is that this? Okay, sweet. Well, it's great to be here. So proud of my Congressman, Tonko. He's great. Give you some numbers, because I love numbers. 90th anniversary of Social Security this year. 60th anniversary of Medicare, Medicaid, the Older Americans Act. 50th anniversary for most of the established area agencies on aging in New York State. 30, the 30th year of the Elder Law Forum. And I got to thank Lou and Beth and the whole team for the incredible service that they provide here. So for those of you, good morning. And if you're online, good morning to you as well. Are you depressed yet? It's not going to get any better. All right. So when we talked about doing this presentation, the world looked a little bit different. So I'm not going to do what I was originally going to do, but I am going to walk you through what's in the slide deck, because what these guys always do is post them and you can look at them later. But just a couple of things coming out of the earlier session. Can we please stop talking about older adults as them, please? They are us, we are them. Let's just add the number of years. And if we're fortunate enough to become older, that's great, because what's the alternative? Yeah, death, exactly. I heard this morning about value. We never go anywhere without talking about the value of older adults. You wouldn't have a local, a regional, a statewide, or national economy. You wouldn't have a not-for-profit sector without the volunteerism. Wouldn't be supporting small businesses without their spending. So the intellectual, social, and economic capital that older adults bring are very valuable. But what we grow up in the United States is thinking something different. That older adults are a drain, that they're frail, that they don't give back. And that's a load of BS. So here's a little info. I presented this last year, but we need to constantly be talking about this, because what we often talk about in the caring economy, first of all, is growing older isn't the problem. It's how we've organized the caring economy. That's the problem. Okay, number one. So when we look at the population and what they're bringing to the table, it's critically important because it makes us think differently. We talked about a reactive system. We spend 97% of our funding waiting for somebody to get sick and be treated, and only 3% to do the prevention, right? We look at the number of nursing home beds versus the number of older adults. The math doesn't work, and a facility should not be the first line of defense, and it often doesn't need to be. But just look at some of these numbers here, because this is real in New York. And we don't talk about that. We don't talk about this type of value and what these contributions are. So those are going to be on the slide deck as well. If you're interested either in our statewide first ever needs assessment study, we had 129,000 responses to this. We have a statewide and by every single county. If you're interested in what older adults think of themselves, their communities, their access, their need, et cetera, you can just put in Pulco, NYSOFA, and go right to the webpage. We also published our innovations guide. This is 18 of our 30 public-private partnerships with tech companies serving 1 million more people, from fraud and scam prevention and mitigation to combating social isolation and loneliness to preventing falls to working with older adults with Alzheimer's and their caregivers and on and on. What you're also going to see is every single one of those 30, what they are, and you can take a look at them. So now I'm going to switch because it's like we're living in the twilight zone. I read a quote from Speaker Heastie yesterday, best budget he's ever seen in his 35 years in the legislature. I've been doing this work in New York for 33 years, best budget I've ever seen, but I also said that last year. So it keeps getting better. And then we're going to talk about the federal government because what Congressman Tonko talked about is literally just the beginning. And so good things are happening in New York State, as was mentioned this morning. If we could take the camera off of me, that would be wonderful. Thank you. Governor Hochul proposed the largest investment in our agency in history, and I've been here for 18 years, and it's fantastic. So again, trying to address individuals that go to our counties or their partners either don't have the workforce staff or the funding to provide services. We got an additional $52 million, including the COLA. Now, how relevant is this? We started this, it's called unmet need, but it's really wait list in 2019. Since 2019, after this budget passed, has been a $200 million investment that goes back to the communities to do exactly what Lou talked about. Help people stay in their homes and communities for as long as possible, supporting their families. And as he mentioned, we can do that for a nursing home eligible individual for less than $10,000 a year. Middle class tax cuts. So I don't look at the budget from NYSOFA. That's just one part. And why is that? Because older adults touch every single system, more or less, just like we do. We interact with Department of Motor Vehicles. We interact with tax and finance. So do older people. So I view the budget from a bigger framework. The middle class tax cuts are going to put money in everybody's pockets. The inflation refund checks are going to put money back into everybody's pockets. There's Medicaid investments. Some of that was talked about earlier, especially increasing reimbursement rates that people have been talking about being too low for forever. Free community college. So this is people up to age 55, and we're going to be working next year to expand that. But this is great. There's a lot of areas where there's need, like, you know, plumbers and electricians and others, HVAC, that pay extraordinarily well that you can't get people to come into. Now, if anybody's had a plumber or electrician come to your house, they're usually not in their 20s. They're in their 50s, 60s, and 70s. So I think that's fantastic in terms of that type of investment. Housing, we know that that's a basic human right. There's so much stuff in the budget to support increasing the housing supply. So you can look at this here. I'm not going to go through every single one of them. But, you know, I was in Westchester not that long ago, and you look at the starter home innovation funding, $50 million. So I was talking to Senator Stuart Cousins, the majority leader, and a couple of others, and said, what's the cost of a starter home? So I just get out of college, I get married, I'm buying my first home. What's the cost of that here in Westchester? $1 million, $829,000, $747,000 in Nassau County. And I'm like, it's no wonder kids are living with their parents. Now, thank God I live in Albany because I don't want my daughter living with me until she's 40. But these things are really important. Rapid response home repair, right? We see the devastation of floods and bad weather, et cetera. So dollars to be able to not only support businesses that get crushed, but also homeowners, and there's more. Redevelopment vacant property, which I love. Changing model zoning and planning. Governor's had a 5-year, $25 billion housing plan. But guess what? In New York, as a home rule state, those decisions are done by municipalities. And if they don't want the housing in their community, it does not happen. So everybody says, well, we need more housing, we need more housing. We do. but it's local jurisdictions that have that control. So she's invested money as well into incentivizing communities to change their zoning. Additional consumer protections, make it easier to cancel online subscriptions. That is really hard to do, especially, again, for older people and people younger. But if you're not always tech savvy, these things become huge barriers. So there's a lot there. Okay. Now let's get a little bit more depressed. But here's what I'm going to say to you, and you're going to hear it over and over and over. You heard it from Congressman Tonko. Proposed. These are proposed, which means they're not a done deal, which means we have 4 months to weigh in. And the question was asked by Benita Zahn, does your voice matter? Yeah, it does. I worked in the legislature. Constituent calls to the assemblyman that I worked for absolutely garnered attention. And I'm going to give you an example when I get to the Social Security of how that voice has already begun to change things and roll back some of those proposals. So I'm going to just focus on HHS. We haven't even gotten into housing and all the other things that are going to come down. Health and Human Services. From NYSOFA's standpoint, we report to the Administration for Community Living, or we did. In 2012, ACL was founded. It brought together the Administration on Aging and 2 standalone disability organizations. That has been dissolved with 50% of the staff fired. Parts of it are moving to the Administration of Children and Families. Parts of it are moving to HHS. We don't know what parts those are, and we're waiting to see what happens. Now, I will tell you, we've gotten our grants through the end of September, so at least they're not clawing any money back from us at this point. HHS has recently submitted their budget to OMB, Office of Management and Budget, just like here, it's the division of the budget. So what I'm talking about here is not politics or political. This is factual. You can check it. We have the documents. The documents were leaked. We know what they're asking for. We know what they're proposing to eliminate. Again, I use the word propose because you guys wouldn't be here in person and you wouldn't be here online if you didn't care about the people that you care for. And so if you're not talking about it and you're not spreading that this is what's at stake, then shame on us. Under our agency, there's going to be a fairly significant reduction in home delivered and congregate meals. And it's really important to talk about this because a lot of people don't know what ACL is. They might not know what the Older Americans Act is. They might not know what the Administration on Aging is. But guess what they know? They know what a home delivered meal is. They know what a congregate meal is. They know what personal care is. They know what transportation is. They know what health insurance counseling is. They know what the long-term care ombudsman program is. And that's what we got to talk about so that people understand where these things are sourced. So they have proposed in our budget to eliminate Title IIID completely. Those are evidence-based programs like diabetes self-management, chronic disease self-management, and others. Title VII. And I can't even look at my table of long-term care ombudsman that's sitting over there and the amazing work that they do, proposing to eliminate nationally the long-term care ombudsman program. We have just started to make headway in New York State in building that so we can hire the FTEs that can go in and serve on behalf of the residents and the families to ensure quality of care. That is being proposed to be eliminated at the federal level. Elder abuse prevention and mitigation. Do I have to explain that? No. Lifespan respite. We have 4.1 million caregivers providing uncompensated care to somebody else in New York State, providing $39 billion of service, proposing to eliminate respite services for those caregivers, whether they're working or not. The HICAP program. I mean, this makes my blood boil when I look at LitCop and HICAP. So at the federal level, it's called SHIP. New York State, it's called the Health Insurance Information Counseling and Assistance Program that helps people 12 months a year. But during an open enrollment, what do you see? You see ads, and they're expensive, and they're rolling. And you got insurance brokers that are hired that are trying to sell a particular service. This program provides objectivity. It's not selling anything. It's selling information objectively so you can pick your plan, pick your prescription drugs, get you set on the Medicare savings program, low-income subsidy, so on, proposed to be eliminated. But that's not all. Adult protective services, nationwide. Falls prevention program, chronic disease self-management, the home energy assistance program. Community Services Block Grant, Title V, we administer part of that, Older Workers Program. Alzheimer's disease research, rural hospital grants. Now, I'm going to stop there because we're talking a lot about Medicaid and rural hospitals. That's just a piece of the puzzle. A lot of these things affect rural hospitals, but the entire, whether it's these, in addition to potential Medicaid cuts, devastates the infrastructure. And while hospitals are a main concern, it's not just hospitals. We use Medicaid to pay the bonds on nursing homes. They pay for staff. They pay for transportation. It's really the entire infrastructure. Mental health and substance abuse. Congressman Tonko talked about that. Talk a lot about fentanyl here. There's a lot of talk about the tariffs in fentanyl, but they're eliminating overdose and fentanyl programs as part of this proposal. Healthcare workforce programs. 16 of them proposed to be eliminated. That's how many there are. To recruit people, didn't we talk about the workforce this morning? To recruit people into health and long-term care. And there's only one in the nation for geriatrics, proposed to be eliminated. Now, every one of these things you see is the heading. Underneath each of them are 5, 6, 7, 8 different sub-grants that deal with that particular topic. The National Center for Chronic Disease, proposed to be eliminated. Reductions of food banks, we're already seeing that. My neighbor volunteers at the big food bank here in Albany. They're down 67% in how much food is coming into the food bank to help feed people. But that's not all. Rural hospital flexibility grants, offices of rural health, family planning, youth violence, traumatic brain injury programs, Alzheimer's research, I said that twice. Sorry about that. Child health programs, overdose prevention, HIV/AIDS, Ryan White, certified community behavioral health, environmental health programs, and HRSA grants. That's just HHS, all right? Then let's get to the big ones. I don't have to go through all the Medicaid stuff. I think the only thing that Congressman Tonko didn't say that part of their proposal is to reduce FMount by 10%. So that'll bring us from 50 down to 40%, but everything else that he said is there. We saw the proposals earlier in Social Security, right? We're not going to cut Social Security, they say, but there's ways to limit access that results in cuts. Does your voice matter? It does, because there's been a lot of outrage in terms of making people go to the office, firing 7,000 staff so you can't go to the office because you can't make an appointment. You're on the phone for 4 hours. Closing of offices. We have 71 Social Security offices in New York State. 40 of them are from Westchester to Long Island. So upstate New York has 31 offices. 57,455 square miles is New York State. That's one office every 737 miles. I have nothing better to do than to just do these numbers. But I think it makes the point. And what's happened is because people were like, this is not good policy. You may not be cutting the benefit, but if you're putting barriers into access, it's the same thing. Is they're rolling these things back. The message, your voice matters. Medicaid, that's been talked about. Said they're not going to do anything with Medicare, yet to be seen. There's talk on one side and then actions on the other. The executive order to lower drug prices is literally meaningless. Drug prices have gone up. The things that they put in the Inflation Reduction Act prior to this year, which actually lowered prices by allowing Medicare to negotiate, those were rescinded. We pay, there was a story this morning, we pay 3 times more than any other country for our prescriptions. The executive order really doesn't do anything. And then $230 billion in SNAP proposed cuts. In New York State, the average SNAP benefit for an older adult is $220 a month. That's $2,400 a year. The average payment for HEAP is $1,000, okay? So that's $3,400. And then if we can get people onto the MSP program through the high cap, that's another $7,000 in savings and money back in a Social Security check. Those 3 programs alone can increase somebody's income by $11,000 a year. So what's next? You are. I am. Becky and I are training our counterparts across the country on how to do this analysis and how to organize. Set something up on her website, and she'll reiterate this later, agingny.org. Check it out. It has this list in there, and and if you want to lend your voice, how you can do that through the site. We have 5 months. We have 4.5 months. And again, I know that you care. You would not be here. I do as well. Your voice matters. These are proposed. I'm going to meet that, Beth, easily. It's a lot easier to stop something than it is to react to it and try to get it back after. So this is our time. Your voices are needed. This stuff matters. It's not just one thing. It's the collection of all of it. And we could be going back if these things go through, but I'm going to say we are going to be successful, not only in New York, but elsewhere, going back to 1800 levels poverty, and we cannot allow that to happen. So thank you all. Please lend your voice. It matters.
All right. I'd like to bring up our next speaker. Willow. It is Willow Baer, the acting commissioner of the Office for People with Developmental Disabilities. She worked as the executive deputy commissioner before ascending to the acting commissioner. She was assistant counsel to Governor Hochul and worked on a number of issues in aging and disabilities. She is a graduate of Albany Law School, like I am, and a fellow attorney and advocate, and has been doing advocacy in these on these issues and in these areas for a number of years. And with that, I give you Commissioner Baer.
Thanks, Lou. Thanks, everyone. That's a picture of me when I stepped into this role less than a year ago, and I looked significantly younger and more invested. I feel like, remember when Obama was in office and we watched him age on television? I feel like that's what's happened to me. I am what's standing between you and your coffee break, so I will try to be brief. I should have brought my 13-year-old with me. There we go. For those of you who don't know the Office for People with Developmental Disabilities very well, this slide just gives you a snapshot of who we are. We serve about 130,000 people throughout New York with developmental disabilities, things like Prader-Willi syndrome, cerebral palsy, autism, etc. We oversee about 500 non-for-profit agencies. We have about 18,000 employees, and we are unique in that we run the state's largest state-run healthcare system with about 1,000 locations throughout the state where we operate our own residential facilities, clinics, and day programs. We talked a lot today about the federal proposal, so I won't belabor it. We do know that there's a recommendation to save $880 billion over 10 years. As much as people say they don't want to cut services, I don't know how that happens without cutting services. OPWDD, as the Developmental Disability Service System in New York, is a $7 billion customer of Medicaid. New York State is in the best fiscal status that it has, I think, ever been, but would not be able to make up the difference in a loss of funding for developmental disabilities, aging, health, et cetera. Director Olsen walked through some of the specific recommendations that would affect the aging population. These are a few that we have seen proposed that would impact our system. We have the State Council on Developmental Disabilities in New York State, that's the CDD. It's about a $4 million annual budget, a very small group of staff that take federal grants and apply them to initiatives and pilots throughout the state that help research specifically ways and innovations to help the developmental disabilities population that has been recommended to either be disfunded or disbanded altogether. As well as the University Centers for Excellence on Developmental Disabilities. We partner with them throughout the state on training, community outreach, our diversity, equity, and inclusion initiatives, also recommended to be disbanded. And the protection and advocacy organizations. In New York State, this is Disability Rights New York, a group of attorneys that represent people with disabilities in litigation and defending their rights and protection throughout the state, also on the chopping block. Okay, so the good news, and I really do think in New York State, this is good news slides. This is the single best budget we've seen, particularly for my service system. I really feel optimistic. There's no other state that I would want to work or live in. So I'm just going to walk through some highlights for my system. For OPWDD specifically, this year's enacted budget has a $13.3 billion investment. This includes our federal match. So Director Olsen touched on a current recommendation federally to cut that FMAP, that federal funding match, by 10%. So we'll see what that does to this total. But for the moment, this is a 7.3% increase year over year for our system. So that is incredible for us. It also includes a continued investment that was made late last year of $850 million. That was to raise the rates for our site-based residential and day service providers across the state. This was the single biggest investment New York State has made to try to catch those providers up so that they could offer a living wage to staff. So we were very pleased to see this continued permanently in the budget. Senator Clear talked about the 2.6% targeted inflationary increase. I think no increase is ever enough of an increase, but this is a $1.5 billion total for the last 4 consecutive years under this governor. So we have made significant inroads in catching these providers up with these cost of living increases and this year's targeted inflationary increase, which covers everyone in my system. That's not true across the board for all human service agencies, but within the OPWDD system, that 2.6% goes to all of our providers. Some other specific things in this year's budget that we're excited about. There is a $25 million investment in this year's enacted budget to establish what we're calling regional disability health clinics. This is a capital grant program. This was an idea born when I visited a local Article 28 health clinic that specializes in providing health care to people with developmental disabilities. And they do that in a very accessible way by making sure they have accessible parking, accessible doorways, sensory-friendly waiting areas. They've connected with local hospital systems to bring specialists in-house so people with disabilities can get all their care on site without having to travel around the state. They see patients from hours away because they have the accessible equipment. The example that I was provided was women needing pap smears who also need a Hoyer lift to be lifted out of a wheelchair can only receive that care in an emergency room, right? So if you are someone who's ever had a pap smear, imagine having to go to the emergency room to get it. So this health provider provides pap smears for women for 3 hours away driving to get that care. So the idea with this grant program is OPWDD will issue awards to clinic providers throughout the state who can expand what they are currently doing to meet a greater need. So whether that's buying Hoyer lifts for more providers or expanding parking or creating EHR connections with neighboring hospitals just to expand that healthcare for our population. Specifically, I'm really, really excited that the governor and the legislature supported this expansion. We also have a $75 million investment in this year's enacted budget to support the modernization of OPWDD's Institute for Basic Research. If you're not familiar with it, it's in Staten Island. It was the first and I think still only research facility created, run by the state specifically to research and support people with developmental disabilities. So there are clinic services there, there's a high-risk birth center there, a brain bank. I have a neurosurgeon on my staff. A lot of really incredible work goes on, but it hasn't really been funded since the 1960s when it was stood up. So we have a $75 million investment to modernize that campus and to build a genomics core facility, which will be run by the state to expand access to genetic testing for people with disabilities. This will also help us identify underlying health conditions and create treatment plans so that people have better health outcomes as they age. Also on this campus is the old Willowbrook State School. So this, everybody in New York, everybody nationally, internationally, right? You say Willowbrook and it conjures a definite image, a definite feeling. There is an old building that was the last part of the Willowbrook State School still sitting on campus. And part of this investment will go to refurbish that building, make it usable. We'll be building a Willowbrook Learning Center there with a lot of old archives. This was an idea born from the Willowbrook self-advocates and family advocates who really wanted to make sure we captured that history and used it as a way to highlight all of the progress we've made in New York. So we're really excited to do that. Also in this year's budget, we know that Executive Order 40, the governor committed New York State to being an employment first state. And there are some other expansions and extensions of tax credits in this year's budget to support that. Okay, home enabling supports. I can't remember if I mentioned this last year when I was here. We had just started working with the federal government to support and build home enabling supports. So very excited that we are almost ready this summer to roll that out, and that is supported by this year's enacted budget. Home enabling supports are for people who live at home, not in a certified setting, and want to stay at home and need a little bit of help by way of technology to help support that without staffing. So someone who lives at home will now have access to up to $5,000 of technology. This can be a medical subscription service so they get telehealth at home. It can be services that help them travel, navigate the community safely, et cetera. Supported decision-making, I think we also highlighted last year, but happy to announce that that is now legal in the state of New York. So this is mental hygiene law, Article 82. For those of you not familiar with supported decision-making, it's really a formalized agreement between someone who has capacity to make decisions but needs some support to make those decisions, but doesn't want to be under an order of guardianship, right? We don't want that for people that don't need it. So a supported decision-making facilitated agreement would be if I'm aging and I can still make decisions, but I want my neighbor to help me with banking, or I want my niece to help me with my medical decisions, we can document this in a formal way. And OPWDD has financed a pilot program the last couple of years, and in this year's budget, we are covered to issue an RFP for statewide facilitation to support supported decision-making for people with developmental disabilities. Some more slides. So just before I wrap up, we know that people with disabilities are aging just like all of the rest of us are aging. 50 years ago, the average life expectancy for someone in our system was 35 years old. It is now the same as it is for you or I. That is not something that my service system was prepared for. We moved everybody out of institutions into homes and didn't really think 50 years ahead to when everyone would be aging and need memory care and increased health care and mobility needs. So something that became very clear to me when I stepped into this role just under a year ago was we really needed some proactive strategic planning around what to do about people aging with developmental disabilities. So same life expectancy, but a higher rate of early onset symptoms and behavioral changes, increased inability to communicate with people. My sister-in-law has Prader-Willi syndrome. It's a very sort of rare developmental disability. She is only 4 years older than me, but already needs help going up and down the stairs, already needs help opening things like a much older person would need. So some of those things are just earlier onset, and we need to make sure that we're prepared to meet those needs. Also during the day, right? It's not just your physical needs, but we know that people with developmental disabilities tend to move to nursing care sooner, tend to just be left at home where they can be cared for during the day. And that's not meaningful, that's not retirement. And so also thinking through how we can provide meaningful day services for people. So we just recently announced the launch of a Commissioner's Task Force on Aging. So I know Senator Clear mentioned the Master Plan on Aging. There was a ton of work done on the Master Plan on Aging, and I think we will see it very soon. I expect, right, Director Olsen, that it will have a lot of really good recommendations for aging throughout New York State. But what I was looking for is some actionable recommendations for my system specifically. So the Commissioner's Task Force on Aging, which is led by our Developmental Disability Advisory Council in conjunction with myself, will pull together experts and stakeholders to really come up with ways that we, within the next year or two, can really make some changes to better support people in our system as they age. So we're really excited about that. And I rushed through that so everyone could have your break. So you're welcome.
And we do have, I will take a few questions, Greg, if you want to be available. If anyone has questions for our commissioner or our director, both acting.
Oh, see,
There's
no
a
good deed
question.
goes unpunished, right?
Anyone? You all want coffee?
Yeah.
Yeah, how about you at home? You want coffee too? Okay. So we have one. All right, here comes the microphone. So as you can see, New York State had a good year. Federally, that debate is going to be raging for the next 3, 4, 5 months, and that's going to be where a lot of these decisions come down, and we hope next year will be as rosy, but that remains to be seen.
Hi, I'm a social worker in home care, and I recently had, oh, it's too loud.
That's our media coach, Beth Wordman.
I had somebody who is on kind of in 2 systems right now, and under the OPWDD, they have a service plan, but their caregiver is a family member. There are no services available for respite or anything for that person. So there's been discussion on taking them out of that system and putting them in another system, but they said that they have their service coordinator come out every year and develop a plan of care, but it's just a plan. There's nothing behind it. So wondering if you can address that and how that's going to be changed? Or
So
the
that
plan for
question
change?
covers just about all of the bad things, right? So I just want to say, I hate the premise that someone would move from one system to another to find care, right? In the state of New York, we're working really hard to make sure that all of that care is integrated, the systems are talking to each other. We absolutely have a way to go to make sure that that's true. The question about availability of staffing, particularly of respite, right? Every human service system in this state and every other state that I've talked to is suffering from workforce shortage. We know that. That's why the investment, the 2.6, the $850 million, all of the other investments we've made, I really hope over the next year we'll see that staffing catches up. A lot of those affordability initiatives, right, that people can afford to keep these types of jobs. And we really are trying every way we can to make sure that those types of community-based programs like respite are staffed and available. I'm happy to talk to you separately about the specific example to see if there's something else we could look at.
Okay, thank you.
Thank you. So one of the issues that we have is home care does not have a seat at the table for most of these discussions. And we have Al Cardillo, who's going to be on a panel, who is the head of the Home Care Association of New York State, and he can articulate this issue. We don't prioritize it. We don't put it on top of the list. The legislators earlier talked about hospitals and nursing homes getting the attention, having the ability to draw the funds. How do we get enough people back into the home care workforce? That is a major issue that we're going to face for many, many years to come. So we're going to take that coffee break. And I want to reiterate for those in the room and those at home, the chat room has been a bit lively, as happens at times. We're talking about policies here, not politics. These are not issues of the right or the left. These are issues in the middle. And what we have to work on is how to work across the aisle to solve these problems. I will tell you that I was a registered Republican. I'm now a registered independent, and I belong to a group called No Labels, which is designed to try to bring legislators together from both sides of the aisle to work on real solutions for the real people that we all represent. So we hope that we can be civil in the chat room. We'll keep it live for the rest of the program. And we want to take this time to take a short break. I want to thank Commissioner Baer, Director Olsen. We will be back after this at 11 a.m. Thank you.